Hi, everyone. Welcome to Dental CE Academy, and I'm Dr. Rowling. We are thrilled to have you here this evening, and we are thrilled to have you join this class this evening. This is exciting information on nano hydroxyapatite. And before we get started, a little bit of housekeeping. We did send an email out to all registrants with the course folder and CE credit instructions. If you don't have that, we have 3 more ways for you to obtain it. Tap on the red banner at the top of the screen. We also have instructions for you in the chat area. You'll see a link as well to tap on and download the handout as well. If anyone needs help with the handout, let us know. You can just type into the chat area. And when we finish the 1-hour CE class, you'll have an opportunity this evening to hear from Dr. Jen and Dr. Jen Natural Products. There will be free samples and a promotional discount. We hope you'll stay on and learn more about how to get nano hydroxyapatite products. Again, it is not required for CE credit. However, we do hope you'll stay on to learn more and take advantage of the promotional discount. And with that, I'm excited to introduce you both to Dr. Jen Eisenhuth, as well as Peter Eisenhuth. Peter is going to start the lecture this evening, both with a background in engineering, both with a huge background in R&D in terms of oral care products and nano hydroxyapatite. You really have the 2 experts here, I might add. I've been looking at their information, and it's amazing how much time they have spent on the research. Now, Peter also spends quite a bit of time training dental practices and lunch and learns, and he interacts with the researchers around nano hydroxyapatite too. So I'm really pleased to turn this over to you now, Peter, and we'll be here in the background and take it away.
Very good. Well, actually, I'm going to pass the torch to Jennifer, if you don't mind.
Okay.
Then she's going to pass.
I got that backwards. All right. Here we go.
That's okay.
You know what? I just wanted to thank Dr. Rowland and everyone for their time tonight, especially spending the next hour learning about an alternative remineralizing agent for enamel. It's been around. Nano hydroxyapatite has been around for over 50 years, but even I and Peter were really just learning about it in the last 5 years or so. And so at the end of this presentation, I will jump into why we entered this arena, give you more information on that. And throughout the day, I have to say, I am still seeing patients in my Minneapolis practice. And so Peter does do a lot of the education for nano hydroxyapatite. And I'm going to let him take the baton and tell you all about it.
Wonderful. And then is Dr. Rowling's brave start in slide 7 then? Am I good to go there? Okay, cool. Awesome. Well, once again, my name is Peter. Thanks for joining me this evening. Dr. Rowling has set a pretty high bar early on. She said it's going to be exciting. Well, I hope I can live up to this because we are going to cover a number of clinical studies. I think as dental professionals, for you to recommend a product, there should be hard science behind it. So hopefully the content that we present with you, you'll stay with me through the presentation. On that note, nano hydroxyapatite, as Jennifer had mentioned, it's gaining in popularity. And I think the first question to ask ourselves, why? Fluoride's been around for a while. There's manufacturers of toothpaste that have been around. They're staples in the oral care industry. And I think that's an interesting question to ask yourself. Why? Why is nano hydroxyapatite becoming popular? Well, I think that it has less to do with maybe the dental institutions promoting it as a new product. I think it has more to do with consumers looking for an alternative. Since COVID, there's been a huge movement amongst Americans looking for alternative options for personal care products, everything from deodorant to shampoo and toothpaste. And the reason for it is they have these things that are called smartphones, and they're starting to Google everything. What's interesting is that 66% of Gen Zs, these are these young families getting out of college or young people in some cases entering the workforce, they're looking for a new dentist or a new practice to join because they moved from their hometown. Well, they're pretty savvy with their smartphones. They have apps now, even on the smartphones, where they're going around and they'll actually take a picture of a barcode of a product. And they have sites that will basically analyze the products to assess whether or not that particular product is a clean ingredient product. Unfortunately, most oral care products that have been developed over the last 30 years just don't pass the test that the young Gen Zs are looking for, and even some of the older population. And so what's brought the rise to nano hydroxyapatite is there's a growing segment of the population that wants what is classified as more of a clean ingredient. They don't want propylene glycol in their toothpaste. They don't want sodium lauryl sulfate. They don't want synthetic flavoring. And in some cases, they don't want fluoride. On this presentation, we're not here to debate fluoride, but our goal is to help your office, and I guess you as professionals, to understand the science behind nano hydroxyapatite. So when you have these patients that are coming to your office that don't want fluoride, hopefully you can feel confident enough about nano hydroxyapatite as a replacement for fluoride for your patients that do not want fluoride. So that being said, let's get this party started. We'll start talking about some of the science behind nano hydroxyapatite. Let's see, what else do we have? We talked about the growth, and then at the end of the presentation, we want you informed enough where you're the experts, so you really know what to look for in a brand if you're going to recommend a product for your patients. Learning objectives. We have a few learning objectives because we want to make sure you guys get CE credit. Big thing is we are going to review some third-party non-funded clinical studies. We'll talk about concentrations of nano hydroxyapatite, particle size, what's required for nano hydroxyapatite to deliver the same remineralizing levels as fluoride. We're also going to talk about how, at least today, the FDA is not regulating nano hydroxyapatite. We get this question a lot, is nano hydroxyapatite approved by the FDA? Well, the FDA doesn't regulate it, and we'll talk about that in more detail. Let's see, and then we'll also talk about what to look for to help your patients make good decisions on a product with efficacy. So the science behind nano hydroxyapatite. Here we go, rock and roll. Now, nano hydroxyapatite is, as Jennifer had mentioned, this isn't a new ingredient. It may be or new material. It may be new to your practice. It may be new to your landscape. However, nano hydroxyapatite and hydroxyapatite has actually been around for half of a century. If you look at other disciplines of both medicine and within the dental profession, the more you seek out hydroxyapatite and nano hydroxyapatite, you're going to see more and more applications for it. For example, if you have an aging grandparent or a parent where their hips are going out, you'll find that there's orthopedic surgeons now that are taking titanium hip replacements and they're coating them with hydroxyapatite. And the reason for that is 60% of our bone composition is hydroxyapatite. So surgeons are finding better compatibility, less fail rate with hip replacements coated with hydroxyapatite. I have some other images here. Bone scaffolding is just another procedure that orthopedic surgeons are going to use on compound fractures. That's a material that's comprised of nano hydroxyapatite. I'm sure you guys recognize the image in the center of the bottom of the screen. Yes, dental implants. We know that certain materials like titanium can cause some corrosion effects if they're exposed to even fluoride. And so what manufacturers are doing is they're coating certain alloys with hydroxyapatite. It's twofold. It's going to protect the metal from the bone being exposed to it, but it also provides, I guess, less fail rate with that particular procedure. The image on the bottom right-hand corner, I'm sure you guys recognize this. This is part of a bone graft procedure. Yes, nano hydroxyapatite is also being used in the aid of bone grafting. What's interesting about this is nano hydroxyapatite is also used today in both cancer detection and cancer treatment. So once again, hydroxyapatite and nano hydroxyapatite, even though for today's purposes, it might be a material that's fairly new to you, it's growing in popularity. It's not going to go away. You're going to see more and more applications for it. But I think the interesting thing to look at is where did this all start? Where did nano hydroxyapatite start from? It's actually a little trivia question here, but Nano Hydroxyapatite was actually created by NASA 50 years ago, half a century ago. So we all know that the first space capsules, and if you want to call them space shuttles, they were super confined. NASA didn't have room to put a bathroom or a shower or a sink to spit their toothpaste in. And so NASA knew early on in the late 60s and in the early 70s that over-the-counter toothpaste was not safe to swallow. So NASA took it upon themselves to take care of their astronauts by creating an edible toothpaste. Well, what was their remineralizing ingredient? Well, what they determined was safe to swallow, yet provided remineralizing for the astronauts, was nano hydroxyapatite crystals. So they engineered nano hydroxyapatite crystals. It was proving to be so effective that in 1974, a company out of Japan bought the patent called Sanji. I bring Sanji up because they're just an amazing company. They've spent the last 4 decades tens of millions of dollars advancing nano hydroxyapatite so it can be used in both medical and dental applications. What's interesting is, Japan is so far ahead of using nano hydroxyapatite. It was in 1993 that the Japanese government approved nano hydroxyapatite in toothpaste as an anti-caries ingredient, similar to how the American Dental Association endorses fluoride in the US. Nano hydroxyapatite was endorsed in 1993. The rest is history. So yeah, we can thank NASA really for the discovery of nano hydroxyapatite. So why is it that our patients need remineralizing? I want to talk about that a little bit. And the reason I'm talking about that is how we started this conversation was why is nano hydroxyapatite becoming more popular? It's because there's a huge shift in America towards clean ingredients. Well, most of these consumers that are getting away from traditional toothpaste, they're going to a fluoride-free toothpaste. I think we can all agree that if our patients have this wonderful bacteria, and I'm joking a little bit, but certain bacteria like Streptococcus mutant, they have a biofilm with plaque on the surfaces of their teeth, and they're eating the traditional American diet with sugars and starches, they're more likely to develop caries if they don't have some ingredient in their toothpaste to help prevent caries. We know that. And so nano hydroxyapatite is really an alternative to fluoride for these patients that want clean ingredients. So I'm going to go into the studies a little bit, and we're going to talk about how nano hydroxyapatite actually works in the mouth, how it works with the teeth. But before I do, I want to do a quick little review of fluoride. I know all of you have been through dental school or hygiene programs. Oops, I got to skip ahead here. That was my mistake in putting slides together. So let's see, we'll stop right there. So we're talking about why is it important our patients have a remineralizing component in their toothpaste? It's mainly because of bacteria like Streptococcus mutant bacteria. Also, the lovely American diet. Some of us like to sip on coffee, carbonated water, maybe citric juices. We know that anytime the pH in our mouth drops below 5.5, and really that's the critical pH of our enamel, we know that around 5.5, demineralizing starts to occur within the enamel surfaces. What is demineralizing? Basically, phosphate and calcium starts to leave the enamel surfaces. Well, to counter that, the human body has its own protection to fight caries. It's called saliva. We know that. And saliva is it's the fountain of youth for our enamel. There's some things in saliva we love. Number one, we love bicarbonate. What does bicarbonate do? It's going to take that acidic environment. It's going to raise it more to a neutral pH of around 7. In addition to that, once the pH comes up, now the saliva is going to start to deliver phosphate and calcium back into the enamel surface. Unfortunately, for most of our patients, they've probably contracted this lovely colony of bacteria that will create acids. As we know, some families get really lucky. Jennifer's grandfather, I don't think he ever brushed his teeth, did he?
No.
Yeah. So how long did he live?
92.
92. So, I wish I had the same, I guess, whatever it is. I don't know if he didn't pick up the bacteria, but we know we have a certain segment of the population. It's around 10%. They never get caries. And sometimes it's because they've never contracted the bacteria that causes the low pH. Unfortunately, grandma kisses the baby, the dog licks the baby's mouth, and they end up with the bacteria. And if they do, generally through the pH cycling, the phosphate and calcium that's brought back into the enamel generally isn't enough to balance the remineralizing. And so at the end of the day, most of our patients, if they have Streptococcus mutant bacteria, or if they're sipping on pH beverages, there's generally a phosphate and calcium deficit. And we know over time, not over a couple days, but over months and years, if our patients have a phosphate and calcium deficit over time, caries develop. And so what can we do about that? Well, traditional approach is to give our patients either a fluoride treatment or have them brush with fluoride. So I'll talk about fluoride a little bit, and then I'm going to talk about nano hydroxyapatite. And then we're going to talk about combining the two, which is even more exciting. This is really relatively recent news. So just a quick recap on fluoride. I'm going to talk about really the two main benefits of fluoride. And we know it does a number of things, but primarily what fluoride is going to do, it creates fluoroapatite. How does it do that? Well, 97% of our enamel composition is hydroxyapatite. So when fluoride is applied either through a fluoride treatment or patients brush with fluoride, what happens is the hydroxy group in hydroxyapatite is replaced with a fluoride ion. Fluoride ions are very dense. They're negatively charged. What it does is it takes the ions of the surface of the enamel, not all of the enamel, but parts of the enamel, mainly the outer surface of the enamel, pulls the ions tighter together, basically creating fluoroapatite. Well, what does that mean? Well, it makes the enamel more resistant to acids. In essence, it drops our critical pH of our enamel from 5.5 to 4.5. This is a good thing. That means that throughout the day, our patients are going to lose less phosphate and calcium. There's less demineralizing occurring. The other thing that fluoroapatite will do, it's actually really good at helping to pull in the phosphate and calcium that's in our saliva. So if I go back to this previous slide, fluoride is going to help to promote more transfer of phosphate and calcium ions back into the enamel surface. Unfortunately, though, fluoride in itself does not contain phosphate and calcium. For fluoride to really be effective at helping remineralize the enamel, we need a good saliva source. And we'll talk about this a little bit later. And this is where nano hydroxyapatite can actually serve your patients better with patients that have xerostomia. So I got to back up to where I was. Let's see if I can find. Let's talk about nano hydroxyapatite. We talked about how fluoride works. Well, if we want to simplify nano hydroxyapatite, the biophysics and the biochemistry of what it's doing inside the mouth, really there's 5 things we can look at. Number one, these crystals, and I'll actually show you what the crystals look like. It almost looks like powdered sugar. You know, it's white, it's beautiful to look at, it's all that good stuff. Well, these crystals love to adhere to the biofilm. So when your patients are brushing with a toothpaste containing high concentrations of nano hydroxyapatite crystals, what will happen is during their brushing process, they're going to have less biofilm, less plaque. Ultimately, that means less acids, less demineralizing that's going to actually occur. We do a lot of research on brushing, believe it or not, probably like most of you, but we have a lot of trivia questions because we have 2 kids in dental school. And I didn't know this, but it was interesting trivia. But I was talking to my son who's at one of the dental schools, and I said, well, hey, can you research this? And the question was, what is the average amount of time that an American spends brushing their teeth? And the time range was 45 seconds to like a minute and 15 seconds. So for all practical purposes, it's 1 minute. And so if we think about that a little bit, if our patients were using an electric toothbrush and it was even, an average toothpaste, they're probably going to remove most of the biofilm, or at least a big part of the biofilm. Now, if we can switch to a nano hydroxyapatite toothpaste, it's going to allow more effectiveness while your patients are brushing. They're going to have less biofilm. So that's a big plus on brushing with a 10% nano hydroxyapatite. Number 2, the crystals will fill in the micro lesions on the surfaces of the enamel. You'll notice this if you brush with a nano hydroxyapatite toothpaste with high concentrations, like fluoride, and I know this is what they're teaching in dental school now. After you're done brushing, don't rinse, just spit. When your saliva removes the residual toothpaste on the surfaces of your enamel, you should notice that your teeth are smoother. I know I've experienced that. A lot of the patients that we work with will also notice that. So it makes the surfaces smoother. It will fill in the surface pores also, elevating the whiteness of the teeth. I don't think nanohydroxyapatite is going to be as effective from what we've seen in the clinical studies at whitening the teeth. However, you will get some whitening benefits, not like you will, say, with hydrogen peroxide or a major, say, Zoom product, if you will. Most importantly, though, nanohydroxyapatite crystals, if they're small enough, they'll be able to penetrate the surface pores of the enamel, enter into the dentin tubules. I'm saying that wrong, sorry. And they actually they provide a chemical bond, delivering both phosphate and calcium below the surface of the enamel. Number 4, managing hypersensitivity. We'll talk about that here in a little bit more. And then also, when you brush with nanohydroxyapatite, or your patients are brushing with nanohydroxyapatite toothpaste, the crystals will actually coat and adhere to the surfaces of the enamel. And what this does is it helps create basically a protection. It helps inhibit bacteria from adhering to the surfaces of the enamel. Let's see, what do we got here? Talking about nanohydroxyapatite crystals, you know what they look like it's a white crystal. But if we break down the chemical composition, it's calcium, phosphate, oxygen, and hydrogen. What's the biggest question you're going to get for this group of patients that don't want fluoride, they don't want traditional oral care products? They're going to ask you, well, is this safe? Is it safe to swallow? Well, based on current research, we can answer that question. It is safe, it's biocompatible. There are baby food manufacturers that put nanohydroxyapatite crystals in their powdered formulations. Why? Why would they do that? Well, nanohydroxyapatite is mainly calcium and phosphate. The pH of our stomach lining is anywhere from 1.5 to 3.5. As we said earlier, hydroxyapatite starts to break down at 5.5. So you get it. If you want to have a source to deliver phosphate and calcium in a powdered baby food formulation, the nanohydroxyapatite crystals work. So it doesn't pose harm in that regard. There are clinical studies, not clinical studies, but there's been research on determining whether or not nanotechnology or nanoparticles cause cell toxicity. I think this is going to be a question that you're probably going to get in your office if you haven't, if you are recommending a nanohydroxyapatite toothpaste. That being said, there are certain materials like titanium dioxide that can cause, break the blood cell barrier. With regards to nanohydroxyapatite, I think it's important to know that your body does produce it. However, regards to cell toxicity, the European Commission just released a report March of this year. It was a very extensive report. We actually have the link on the very bottom of this slide. This is for the European Commission's report. They studied nanohydroxyapatite in assessing whether or not it could cause cell toxicity. In their opinion, they deem that it couldn't, that it is safe in toothpaste. However, the European Commission did put 2 requirements for it to be safe in toothpaste. Number 1 is that the concentration of the toothpaste, of nanohydroxyapatite in the toothpaste doesn't exceed 10%. Number 2 is that the actual crystal shape is rod shape. So I think this is a nice takeaway, or important takeaway, when you have patients asking you if nanohydroxyapatite is safe, if they're concerned about the safety requirements of it. As with what the European Commission has reported, rod does pass the test. I do want to talk, though, about other crystal shapes. There's a number of crystal shapes. It depends on how it's manufactured. On that note, most nanohydroxyapatite in toothpaste is synthetic. However, there are ways to manufacture nanohydroxyapatite using natural ingredients. Amorphous is really interesting. That's actually eggshell. So that's one way to create a natural nanohydroxyapatite crystal. You can also use bovine teeth, and you can use seashells. Needle is what's really interesting. And if you read the European Commission report, they actually have concerns with the needle shape. Well, if you analyze the nanohydroxyapatite crystals in your bones, this is the same nanohydroxyapatite our body creates. It's a needle shape. So the big takeaway here regarding safety is, as long as the concentration doesn't exceed 10% and it's a rod-shaped crystal, it's going to pass the European Commission safety standards. Let's see, we already saw that slide. There we go. Okay, this is where it gets really interesting. Do you want to talk about this?
No, go ahead.
Okay, all right. Well, this is probably the biggest takeaway for all of you. I think it's really important to know, as of today, the FDA doesn't regulate nanohydroxyapatite. We hope that at some point they regulate it like fluoride. Currently, the FDA does classify fluoride as a medicine. As a result, and you guys know this, if you look at any fluoride manufacturer, if you look at the back of the box, companies that create toothpaste with fluoride in them, they have to actually list the type of fluoride. Is it sodium fluoride? Is it stannous fluoride? They also have to list the concentration. Is it 0.2%? Is it 1.1%? And this is wonderful for the consumers. I think it's so important that consumers have complete transparency of what they're putting in their mouths, what's going into their body. Unfortunately, Nano Hydroxyapatite doesn't have that requirement. So when you remove fluoride from a toothpaste, the FDA more or less kind of leaves it alone. It falls under cosmetics. The problem with this is that there's a lot of brands out there that are taking advantage of this hype in Nano Hydroxyapatite. We've met with a number of manufacturers all over the country that make toothpaste and Nano Hydroxyapatite toothpaste. And it's a very interesting conversation. What you're going to hear from manufacturers, I'm talking about manufacturers' facilities that actually make the toothpaste, you're going to hear that the concentrations that most manufacturers put in their toothpaste, it's a wide range. It's everything from like 0.1% concentration to about 5%, at least in the US. And I think the important takeaway here is that, you know, if you are going to guide your patients towards using a Nano Hydroxyapatite toothpaste, I think it's important that they understand that this isn't a product that's currently regulated in the US, and that there are certain requirements for the Nano Hydroxyapatite to be just as effective as fluoride. So I'm going to go ahead and go over some of these requirements. Before I do, though, here's the dry stuff, guys. PubMed. If you haven't gone to the National Library of Medicine recently, it's a great place to go. What's interesting is our daughter presented on Nano Hydroxyapatite at her dental school 2 weeks ago, and she used some of these slides, and she said, "Dad, your slides are outdated. You have," because we typed in Nano Hydroxyapatite in PubMed just to see how many clinical studies there were. And I think this might have been done about 3 or 4 weeks ago. So there was 2,923. And she said, "Dad, there's like 2,960 clinical studies on Nano Hydroxyapatite." The point here is that Nano Hydroxyapatite, it has a deep history, and there's a lot of science behind it. And it just so happens to be one of the most popular ingredients that study. And thank God for this. We have more medical schools, more dental schools testing the ingredients, proving it, testing it out. If you can see the timelines on the left-hand side of this PubMed sheet, we could see 1970 to 2024, huge spike. Over the last 5 years is where most of the clinical studies have come out. And so I think this is great. You can expect, I would say a year from now, some of the content that we're presenting might be outdated. That's how fast new studies are coming out on Nano Hydroxyapatite. Now for this evening, we don't have time to go through 2,900 clinical studies. So we're just going to hit the main ones, tying basically into toothpaste, showing the efficacy behind it. This was a study published in the last 5 years. It was published October of 2019. I like to analyze this study or look at this study because it's actually comparing Nano Hydroxyapatite against fluoride and one other ingredient. And so how most of these studies are done, some are done in vitro, some in vivo, but what they'll do is they'll take real teeth, they'll put them into basically an acid batch or a bath, demineralize them, and then go through pH cycling, applying a remineralizing or toothpaste with a remineralizing component. And then they'll analyze the surfaces for how much of an increase of remineralizing that had occurred. With this particular study, I'm not going to read the study to you. However, I do want to reference it. If you like science, go to PubMed. You can look it up. It's a great study, but I'm just going to hit the highlights of the study. So if we look at what they tested, they actually tested 3 different toothpastes with 3 different ingredients. The first one was ApGuard Royal. ApGuard Royal has been around for a long time. They use 10% Nano Hydroxyapatite. You're going to hear 10% over and over again. The other ingredient is it's a newer toothpaste from what we're familiar with. It's actually out of India, Shinim. They used 5% calcium sodium phosphosilicate. This is an ingredient we're not that familiar with. However, we're reading more and more clinical studies. This might be a time for a different CE event to investigate this ingredient. But the good news here is I think there are alternatives to fluoride, and we're happy that more scientists are working hard at putting new products out there. But the third ingredient, fluoride, and it was a fluoride at a higher over-the-counter level of 1,450 parts per million. I think that's like 0.24% fluoride. The outcome of the study, though, we can see the summary with the graph on the right. These were the remineralizing levels that had occurred after the pH cycling. With this particular study, it just so happened that the toothpaste containing 10% nano hydroxyapatite had the highest levels of remineralizing. The sodium phosphosilicate was, it did provide remineralizing, which is good. So it's good to know there's other materials out there that can provide remineralizing. And then the toothpaste with 1,450 parts per million performed less. Or I guess we can say, in other words, with this particular study, the 10% nano hydroxyapatite actually outperformed the fluoride with 1,450 parts per million. This was the actual conclusion of the study. Like I said, if you guys like clinical studies, you want to really dive into it, go to PubMed. All of these studies are up. I'm going to put up one other study that was done at the University of San Antonio, Texas. This one was done using different toothpaste, both fluoride and a nano hydroxyapatite toothpaste. This study, though, it's actually a really interesting read. The reason for that is they took extracted teeth, healthy teeth. I believe it was teeth that were extracted due to orthodontics, somebody with crowded teeth, you know the drill. What is it, 4 on the floor? They found 4 healthy teeth from each patient. I can't remember what the number of samples were, but basically they took healthy teeth, same thing. They cut blocks of healthy enamel out of the teeth themselves, put them in an acid bath, demineralized them, basically created artificial caries, attached them to orthodontic attachments. And yeah, you guessed it. They found participants to actually put extracted teeth in their mouth. Granted, it was on an orthodontic attachment. I've had one conversation with one of the dentists involved in the study, and I didn't ask him, but I am curious to whether or not the patients actually knew, or the subjects knew, they had somebody else's teeth in their mouth. But it was just a great way to be able to do a study within the mouth with healthy saliva flow. The outcome of the study, and I'll go to the next page, was when they removed the orthodontic attachments, they analyzed the enamel for remineralizing levels using a polarized light microscope. The remineralizing levels on this particular study were pretty much identical. Now, if you type in nano hydroxyapatite toothpaste in PubMed, there's at least 51, last I checked, there was 51 clinical studies showing efficacy behind nano hydroxyapatite, similar to, actually these are just 2 of many of the studies on PubMed, but I think they're worth noting. Our takeaway, if we're going to look at these clinical studies, what these doctors and dentists proved is that nano hydroxyapatite at concentrations of 10% are able to provide the same remineralizing levels as fluoride, which is wonderful. Now, we're back to the Wild West. As we mentioned, we are truly in the Wild West. The problem with that is as we said earlier, there's not a requirement for brands to offer transparency. From the previous 2 studies, though, we can pretty much dial in that 10% is a great concentration. Well, are there clinical studies actually testing different concentrations? Well, yeah, the answer is yes. This was a clinical study published June of 2009, testing concentrations of nano hydroxyapatite. And this is where I think it's really important to reference the study. And the reason for this is there's brands out there that are putting in diluted concentrations of nano hydroxyapatite, and yet they're promoting their products to provide the same remineralizing levels of fluoride. Based on what clinical studies are available on PubMed referencing nano hydroxyapatite providing the same remineralizing levels of fluoride, they're done at high concentrations of 10%. So the question that's being asked right now is, does concentration matter? So within this clinical study, they tested this question. Well, does concentration matter? They tested 1, 5, 10, and 15% concentrations to assess the level of remineralizing. What's interesting, and I'm not going to read the whole study, but we'll summarize it. But when you go from 10 to 15% concentrations on nanohydroxyapatite, there was really insignificant levels of improvement or higher levels of remineralizing. However, we've got a summary, this chart on the left. This is just a summary of concentrations at 1 and 5 and 10%. When you cut the concentrations of nanohydroxyapatite below 10%, remineralizing levels drop significantly. The gray bar does represent 1%. The teal chart represents 5%. And yes, the black chart is 10%. And as we showed with previous studies, that's going to provide an equivalent level of remineralizing. The problem with this right now, what we're seeing is that there's a lot of brands using social media to promote products. And unfortunately, most consumers that are using influencers to purchase products, they don't have access to these clinical studies. And unfortunately, some of these brands that have very low concentrations of nanohydroxyapatite through their TikTok ads and different podcasters and bloggers, they are suggesting that concentration doesn't matter, number one, and number two, that you can get the same remineralizing levels as fluoride with low concentration. To this day, December of 2023, we haven't read any clinical studies supporting concentrations less than 10% providing the same remineralizing levels. To the contrary, the summary of this particular study, they're suggesting that 10% is the optimal level for remineralizing. So once again, we're in the Wild West. Help your patients if they want. Ultimately, if they want the best caries protection and they want a toothpaste that's going to give them optimal levels of remineralizing, 10% is really an important takeaway. There is another way to cheapen toothpaste, or I guess make your toothpaste cheaper, and that's to replace nanocrystals. We talked about nanocrystals and how important it is that we have a crystal small enough to, maybe we didn't, I guess we're talking about now, we'll talk about the crystal size and why that is important. If we look at the image on the left side of the slides, that's an animation of a tooth surface. We know that the surface pores are very small. A typical surface pore on the enamel is less than 100 nanometers. If we look at the image on the right, we have a cross section of a dentin tubule, and the actual diameter of that is going to be generally smaller than 50 nanometers in some cases. So for nanohydroxyapatite to remineralize below the surface of the enamel, to actually enter into the dentin tubules, they have to be very small crystals, generally around 50 nanometers or less. That's kind of the sweet spot from what we've read about nanohydroxyapatite. Now, nanohydroxyapatite crystals are very expensive to manufacture. And that's one of the reasons why some brands don't put in a full 10%. The other way, though, to make your toothpaste a little bit cheaper, or not a little bit, a lot cheaper, is to replace a nanocrystal with hydroxyapatite crystal. And there is a difference. Micro and hydroxyapatite crystals generally run 1,000 times larger than a nanocrystal. It's not to say that hydroxyapatite is not going to provide some remineralizing benefits. That the hydroxyapatite crystals that adhere to the surface of the enamel will provide some phosphate and calcium. However, if we review the clinical studies that we just referenced, they were done using crystals smaller than 100 nanometers, or classified as a nanocrystal. Hydroxyapatite cost 1/5 the cost of a nanocrystal. And so it's the Wild West. Brands don't have to even classify or list the type of particle size. But back to what we said earlier, if you want to help your patients be able to identify a toothpaste that's going to provide them optimal levels of remineralizing, you're going to want to make sure it has high concentrations of 10%, but also that the crystals are small enough to get into the surface pores, into the dentin tubules. Okay, it's hypersensitivity. I'll talk about this a little bit. We had no idea that nanohydroxyapatite would be as effective as it is with managing hypersensitivity. Within your practice and all over the country, we're talking to offices that have swapped out traditional sensitivity management toothpaste with hydroxyapatite, and they're seeing better results. What most toothpaste brands put in to manage hypersensitivity is potassium nitrate. You guys remember this from chemistry, right? Potassium nitrate, it's the same ingredient in explosives, rocket fuel, and fertilizer. How we started this conversation, there's a movement towards cleaner ingredients. Well, potassium nitrate doesn't check that box. More importantly, potassium nitrate in itself really doesn't do anything to address the underlying problem that's causing sensitivity. Instead, it goes after the symptoms. When you put potassium nitrate in toothpaste, what it's doing is when patients brush with it, it's getting into the surface pores. It's actually getting into the nerves of the teeth, creating a pain block, basically canceling the pain signal from the nerves of the tooth to the brain. So it's quite a bit different than nano hydroxyapatite. Nano hydroxyapatite, the other case, I guess, it's going to protect the areas that are causing sensitivity. Instead of going after the symptoms, it goes after the underlying problems. This is just one of many clinical studies. Last I checked, I believe there's at least 15 clinical studies on PubMed showing the efficacy of nano hydroxyapatite with managing hypersensitivity. I love this study though, because a picture is worth 1,000 words. If you look at the image on the left, yes, we have exposed dentin, and we can see exposed dentin tubules. Now, image B, basically that's after brushing with high concentrations of nano hydroxyapatite. So instead of creating a nerve block or pain block, nano hydroxyapatite is going to go in, and it's actually going to go in and coat and protect areas of exposed dentin. It's also going to help protect areas of weak enamel. Like I said, this is just one clinical study. If we want to summarize the study in itself, basically, this is a summary. The longer the patients were on nano hydroxyapatite, the less hypersensitivity they have. We talked to offices all over the country that have swapped out their potassium nitrate ingredient in a toothpaste, and they're using high concentrations of nano hydroxyapatite, and they're seeing less hypersensitivity. So it's just a great product, not only for remineralizing, it does have other ancillary benefits that one would be hypersensitivity. Now, nano hydroxyapatite does cost more. This is probably the biggest downside to nano hydroxyapatite. Fluoride, as we know, only requires low concentrations, around 0.22%, almost 0.25% for it to be effective in toothpaste. Well, when you take fluoride out and we want to replace it with an ingredient that's going to allow the same remineralizing levels, as we said, you're going to need high concentrations of nano hydroxyapatite. The crystals themselves are the most expensive ingredient in a nano hydroxyapatite toothpaste. Typically, a tube of toothpaste with nano hydroxyapatite in it, if it has high concentrations, it's going to cost around $20, in some cases $30 a tube. However, if you break this down, it comes out to about $6.70 a month, 20 cents a day. It's for your patients that want clean ingredients and they want optimal remineralizing. It's a really good replacement for fluoride for those that do not want fluoride. Now we talked about how xerostomia is basically reducing the amount of saliva, mainly phosphate and calcium. What's interesting is for most patients that have xerostomia or high caries related to xerostomia, the most popular approach in treating this is high prescription fluoride toothpaste. As we shared with you earlier, fluoride in itself, and that's the image on the left side, it doesn't contain the needed phosphate and calcium to remineralize. It's somewhat dependent on healthy saliva flow. That's why we have patients that are very disciplined. They have good hygiene. They're brushing, they're using fluoride, yet they have high caries. They just don't have the phosphate and calcium to remineralize. Well, what's really interesting about nano hydroxyapatite is if you combine nano hydroxyapatite with fluoride, you end up with the best of both worlds. There's clinical studies done testing this. And so instead of having to give a patient high prescription fluoride toothpaste, there's a new solution. It's called a nano hydroxyapatite combined with fluoride. You get a synergistic effect. This is one clinical study proving this theory. This was published winter of 2017. I'm just going to highlight the study, but basically what happens is if you combine nano hydroxyapatite with fluoride, you're getting the best of both worlds. You get the fluoroapatite with the fluoride, which is going to reduce the critical pH. With the nano hydroxyapatite, you get the phosphate and calcium. With this particular clinical study that I referenced on PubMed, I'll just go through the highlights of it. The black bar represents remineralizing levels with fluoride alone. When you add high concentrations of nano hydroxyapatite on top of the fluoride, you get a significant increase. This is proving to be a safer, a cleaner ingredient over high prescription fluoride toothpaste. For a lot of your patients that have xerostomia, A lot of them are on prescription medication, or in many cases, they already have an underlying health issue. And so if we can find a cleaner option than high prescription fluoride toothpaste, that's just a wonderful thing. Now, in addition to, what do we got? Oh, whitening. We'll talk about whitening a little bit. I think from what we've seen with nano hydroxyapatite, it does provide some elevated whitening. However, it's not going to deliver the same whitening levels as, say, a hydrogen peroxide or carbamide? Can't even say carbamide, a peroxide. However, there are clinical studies on PubMed showing that high concentrations of nano hydroxyapatite do promote whitening. This was a clinical study done. When was it? It was released fairly recently. When was it? August, last summer of 2022. They tested nano hydroxyapatite at 2 concentrations. It's an interesting read. At the end of the study, though, you'll see that the concentrations, this is the summary of it, they tested 1% nano hydroxyapatite against 10%. Surprise, surprise, 10% performed pretty well. However, the 1% concentration didn't provide a lot of whitening. But I think this is just another ancillary benefit. If you're going to expect your patients to get higher levels of whitening or I guess huge improvements with nano hydroxyapatite, we haven't seen it. They'll see some ancillary benefit with whitening, but from the research we've done and from what we've tested, it's something that is an added benefit. I think there's some questions on nano hydroxyapatite that come up quite a bit. And the reason for it is this is the Wild West. There are brands out there that are promoting their brand, and I get it. They want to sell more toothpaste, but in the process of doing it, sometimes they put out misinformation. One of the blogs out there, the post, and I'm sure if you've studied nano hydroxyapatite, you've probably read it. There's somebody out there saying that, well, glycerin stops mineral uptake. Well, that's not the case. This is a clinical study done showing the efficacy of nano hydroxyapatite using a glycerin-based toothpaste. The first clinical study that we referenced showing nano hydroxyapatite at 10% to be just as effective as fluoride at 1,450 parts per million was in a glycerin-based toothpaste. So I think another takeaway here is if you're getting conflicting information, what I would ask manufacturers or people posting this information, ask them for third-party non-funded clinical studies. Every claim that I mentioned this evening supporting nano hydroxyapatite's attributes, I was able to reference clinical studies done on PubMed. These are non-funded clinical studies. What do we got? Oh, xylitol. Xylitol is a hero ingredient. You guys know this. If you can add in xylitol on top of your nano hydroxyapatite, now we're doing great. Nano hydroxyapatite crystals in themselves, as we said, will adhere to the biofilm, reducing the amount of plaque or biofilm on the surfaces of the enamel. As you guys know, you already know the xylitol is a hero ingredient. If you can add in xylitol on top of your nano hydroxyapatite toothpaste, it's going to help curb the amount of bacteria, mainly Streptococcus mutant bacteria. This is a clinical study. Yes, it's on PubMed, showing how much of a drop of bacteria, Streptococcus mutant bacterial count you'll get at 10% concentrations of toothpaste in the toothpaste. The teal chart represents before brushing, the black is after. So it's just a wonderful ingredient to have in any toothpaste, but you will get a synergistic effect if we can add that in any nano hydroxyapatite toothpaste. Peppermint oil or essential oils are another thing that we're seeing within clean ingredient oral care products. The reason for that is peppermint oil in particular, and this is a third-party clinical study, there is science showing that peppermint oil will help reduce some of the bacteria tied into gingivitis. Most importantly, though, not most importantly, but the thing that I think most of us gauges on is halitosis. The tongue is a great place for fungus to grow in the crevices. So if your patients are using a clean ingredient toothpaste with essential oils, peppermint oil, they should notice less halitosis, especially if they're massaging the posterior of their tongue at the end of their brushing cycle. Let's see. Review. You want to go ahead and read those, Dr. Jim?
No, go ahead.
Okay, well, let's see. So based on the clinical studies that we referenced this evening, we can support that nano hydroxyapatite is just as effective as fluoride, provided, number one, that the concentration is a high concentration of 10%. Number two, that the crystals are nano. As we mentioned, we need to get them to get into the surface pores, get below into the dental tubulars underneath the surface itself. Nano hydroxyapatite is clinically proven to manage hypersensitivity. We've got 10 and 15%. I didn't mention this. The clinical study that I referenced from PubMed, they tested both 10 and 15%. There are additional clinical studies supporting hypersensitivity management with nano hydroxyapatite on PubMed. And then let's see, nano hydroxyapatite with fluoride. That's a rock star blend. It's awesome. And like I said before, we're seeing offices switch to high concentrations nano hydroxyapatite with fluoride away from high prescription fluoride toothpaste and getting better results. 10%, high concentrations. That last clinical study we went over was the whitening benefits. Yes, we can get some whitening benefits from nano hydroxyapatite, especially at higher concentrations. These are all of the clinical studies that we referenced this evening. We'd be happy to provide you with more. From there, I think that's pretty much it. Questions?
We have a few questions, as you can imagine here. Peter and Dr. Jen, excellent presentation. And let's go ahead and tackle a few of these questions. If we don't get to all of the questions, you do have a copy of the handout. Hopefully you've downloaded it. Tap on that banner at the top of the screen. You'll have the course folder, their handout for the CE webinar, as well as their promotional webinar that will be coming up in just a minute. All right. Is it safe for breastfeeding or pregnant patients?
That's a slippery slope in the sense that we never go there. I think it's always good to speak with your OB/GYN. Everybody's situation is different. That being said, as far as the clinical studies we've referenced, we haven't read anything saying that it's harmful for breastfeeding or people that are pregnant. But yeah, always ask your OB/GYN anything related to those questions.
Okay. Another question, somebody read that the crystals can lodge in the lungs.
Yeah, no, that's a really good question. There are, as we said earlier, there's a lot of information online. Now, that was the whole point of the European Commission. And let me back up a little bit. Nanocrystals of any material, of dirt, we have nanocrystals of dust in the air right now around us. We're breathing in, okay? We're going to get that into our lungs, okay? The bigger question is nano hydroxyapatite going to be harmful? Does it cause cell toxicity? The study that we're referencing is the European Commission study. It's a very in-depth study. There's a link on it on the website. I would recommend anybody who has concern with cell toxicity or anything that's causing harm to the lungs to read that clinical study. But from their opinion, they're saying that nano hydroxyapatite crystals in a rod shape do not pose threat to causing cell toxicity.
Question about how abrasive is the toothpaste with nano hydroxyapatite?
That's a really good question. That's going to depend on the manufacturer because most manufacturers will put in other ingredients like calcium carbonate or silica, but nano hydroxyapatite crystals in themselves, if you can equate it to super fine sandpaper, the RDA value on most nano hydroxyapatite crystals is usually less than 4. So that's the beautiful thing. We talked about removing the biofilm. You do not need high abrasives when you're using high concentrations of nano hydroxyapatite. So there's not a need for toothpaste manufacturers to really step up the silica or the calcium carbonate.
Question here from Brenna, and I want to also remind everybody, following the CE presentation, there will be a presentation from our sponsor, Dr. Jen Natural, and they're going to talk about their nano hydroxyapatite products. And Brenda's question is, can you provide any brands that have the 10% with nano hydroxyapatite? And there will definitely be that recommendation following this. So if you can stay on a few minutes and you'll be able to claim some free sample as well as take care of a promotional discount or take advantage of that. Okay, question here. Which companies make the rod-shaped particle powder for use in dentistry?
Great question. I do not know all of the manufacturers. There are dozens, if not hundreds, of nano hydroxyapatite manufacturers in the world. And I can't answer that question with without singling out one or two, and I don't really want to do that. However, if you Google nano hydroxyapatite manufacturers, you could find many of them out there. I will tell you that we like the rod shaped crystal, but yeah, I'm probably not the best person to list because I don't want to leave anybody out. The point here is there's many manufacturers of nano hydroxyapatite crystals that make rod shape.
Question about, are there any restrictions for specific patient populations?
That's a great question. Now, and this is probably more of a doctor question, like when we talk about fluoride. As we said earlier, the FDA has lots of restrictions with fluoride, but with nano hydroxyapatite, there is no restriction. We recommend it for all ages. So young children can swallow it, as we mentioned. And as far as older adults, we're finding that nano hydroxyapatite serves the aging population quite well because of xerostomia, and they're more likely to have hypersensitivity issue. So as far as what research that we're aware of, there are no age restrictions on the low end or the high end regarding the use of nano hydroxyapatite in toothpaste.
Okay, that took care of about 6 questions that we had about age. Is there a difference in the time which you brush? For instance, 1 minute versus 2 or 3 minutes?
That's a great question. The clinical studies we referenced simulated a 2-minute brushing cycle. That being said, we have never read clinical studies. That's a great question, though. If somebody tested brushing at 30 seconds a minute, I think if there's somebody at a dental institution here, they should test that out. That being said, yeah, with the clinical studies we referenced, they were all done using a 2-minute brushing cycle. So we don't have any data on time, I guess, showing data on different times of brushing. Yeah.
Okay, there's a question about FDA approval. Do you want to repeat what you said, Peter, about how the FDA looks at nano hydroxyapatite?
Yeah, definitely. As of December of 2023, the FDA classifies fluoride as a medicine. So that's why fluoride is regulated in toothpaste. Once you remove a medicine out of toothpaste, toothpaste falls under beauty products, and nano hydroxyapatite falls in line with that. So the FDA currently in the US does not regulate nano hydroxyapatite in toothpaste because it's not classified as a medicine.
Okay. And then there's a question here about, we know if nano keeps plaque down, how does it aid with the patient that tends to build up a lot of calculus?
Yeah, we don't have studies on calculus or tartar. I think that's where you guys are going to have to go old school and take out a little elbow grease and get the instrument. So that's a good question. I hope that if there's institutions out there that are part of this presentation, I think these are great ideas for clinical studies. We're not aware of any studies on calculus or tartar removal with nano hydroxyapatite.
There is a question here from Dr. Kennett. Dr. Kennett, reach out directly to Dr. Jen and Peter with the contact information, and they can send you those. Is the concentration recommendation different for small children?
You know, as far as we're back to the clinical studies, there's nothing in there on age requirements. I think, no, we don't.
Not that I would say not that we've seen on PubMed. You know, we've done a lot of research regarding it, and that might be another great study to look into. But as of now, we haven't seen anything that regulates different concentrations based on the age.
I think what you want to look at, though, is amount. A pea size is going to work for a full mouth. What's interesting is within the fluoride realm, they recommend rice size. And the reason for that is because fluoride's not safe to swallow, and most young kids are going to swallow their toothpaste. Now, so what I would look at it based on the science and the chemists that we talk to is how many teeth do they have? Unfortunately, we don't have an answer for age other than we recommend nano hydroxyapatite for all ages, including young infants.
There is time for, I think, one more question here. It's a great question. How about recommendations for head and neck radiation?
Beautiful. That's probably the best question of all of them are great questions. This is a problem. This is a huge problem. We talked about the biochemistry and biophysics of fluoride, where fluoride is going to create fluoroapatite. However, if somebody goes through chemo, their saliva is pretty much destroyed, or their phosphate and calcium. Nano hydroxyapatite crystals trump it all day, every day. And the reason for it is if you have high concentrations of nano hydroxyapatite, it's going to deliver adequate phosphate and calcium for remineralizing. Now, and I think, Dr. Rolling, you know this better than most people teaching xerostomia. In addition, though, throughout the day, your patients with xerostomia most likely will need some other type of gel or something to maybe a xylitol gel to help prevent burning mouth syndrome or dry mouth. But as far as remineralizing, though, a nano hydroxyapatite toothpaste at high concentration is going to serve any patient with xerostomia much better.
We are going to now transition to the promotional webinar, and I hope you'll all stay on. It's not required, but Dr. Jen and Peter are going to talk about where to purchase nano hydroxyapatite products, and it's Dr. Jen's Natural. If you don't have the handout, you'll need it, because this is a way to reach out if we did not address your question. Tap on the red banner at the top of the screen. It was also emailed to everyone. Again, our apologies if we did not get to all of the questions tonight, but there were quite a few, and some of your questions are specific. And if you're staying on for the promotional webinar, and we hope you are going to be able to stay tuned now for promotional discounts and also to claim samples. And I am going to go ahead here. We're going to put a banner at the top of the screen in just a minute. We have quite a few folks downloading the handout. And we thank everyone for being here this evening. And an excellent presentation by Peter and Dr. Jen. It's extremely critical information that we have these options. Dr. Jen's going to talk to you why here in just a second. So let's go ahead and turn it over to the promotional webinar again. And thank you all for being here. And now we're getting even into the more fun part. And again, the banner at the top of the screen is going to change. You're going to see a promotional code and how to get free samples. Thank you.
All right. Well, thank you so much, everyone, for listening to the science. As Dr. Rolling said, now we can really get into the heart of why we jumped into the clean ingredient toothpaste. It wasn't something that we ever anticipated doing. When I graduated from dental school years and years ago, I learned about fluoride. That's what I've been recommending all this time. Really, what changed it is this young lady here. This is our daughter, Claudia, when she was in her final year of college and about to enter dental school. She contracted C. diff, and she contracted this after or during actually a root canal that she was trying to take care of during finals. And I think there was just some miscommunication between the dentist and the endodontist, and she was overprescribed amoxicillin and contracted C. diff. And she actually got sick enough that she needed to be hospitalized at the Mayo Clinic for several days. And one of their younger patients that needed to be hospitalized. And while she was there, the physicians really talked with her and us about the importance of using very mild and clean ingredients. We almost essentially had to treat her like she was a baby, like she was an infant. And so her biome had been wiped out and destroyed. We needed to use clean ingredients, shampoos, laundry detergents, and toothpaste. And I really thought, okay, toothpaste, I can find this. I'm a dentist. And so we looked into natural toothpaste, clean ingredients. I wanted to, of course, to have a remineralizing agent. And honestly, I could not find one. And at least, if you look at all the studies and making sure that it had the right remineralization. And so that's why we dove into this, ended up hiring a retired chemist from Big Box Toothpaste, and he helped us design and formulate this toothpaste.
We're good. You want to talk about the
Nope,
superpaste?
you go.
Yeah. Okay. We can actually mention brands now. So I think one of the questions you had as a group was what are brands using 10%? We talked about Sanji. Sanji is an amazing company. They're the ones who bought the patent from NASA. They've spent 4 decades, tens of millions of dollars testing, refining nano hydroxyapatite. Their premium toothpaste we referenced in the clinical study. It's called the AppGuard Royal Toothpaste. So that's one company that uses 10%. And then yes, Jennifer's toothpaste, all of her toothpaste contain 10%. We also talked about this is a product, the superpaste. This is revolutionary. This is new technology. Most of the toothpaste that's being recommended to manage high caries are formulations that were created 30 years ago. They usually have sodium lauryl sulfate in it. They have PEG in them, artificial flavoring, and yes, high levels of fluoride. Well, as we shared with you with the clinical studies, there's an opportunity here where we can give our patients higher levels of remineralizing if we can approach this with a synergistic effect by using fluoride with nano hydroxyapatite. So this, as of today, who knows, there's probably some manufacturers that are watching this podcast. As of today, this is the only product out there that uses 10% nano hydroxyapatite with fluoride. So for your patients that have high caries, whether it's xerostomia, weak enamel, this is just a great product. All over the country, we've had offices swapping the superpaste in place of the high prescription fluoride toothpaste, and we're actually seeing better results. Now, we have this slide up because we're not your typical toothpaste manufacturer. I think it's important to know who's behind the brand. Jennifer she's obviously gone through dental school. We have 2 children that are also in the program. This is our son, Gabriel. The reason we have him up on the slide is Gabe was very instrumental in doing a lot of the research. He has his master's in biomedical science. Yes, his thesis was on nano hydroxyapatite. He's a current dental student. That being said, our products, we really work hard and hopefully picked up on this at doing the research, following the science, and then also making sure our ingredients are mirroring the clinical studies. This is a study, can't cover that. This is a study done testing our superpaste against high prescription fluoride toothpaste in a xerostomia. It was a pilot study we had done last week. And so does it really work? Does the superpaste outperform high prescription fluoride toothpaste? Yeah, it does, especially in a xerostomia environment. The superpaste on that pilot study outperformed 5,000 parts per million fluoride toothpaste by 6 times with remineralizing. And if you want to learn more about that study, feel free to contact us after our presentation. So if you want fluoride and you just want higher levels of remineralizing, nano hydroxyapatite combined with fluoride is just a great alternative for high prescription fluoride. We have a product, it's called the superpaste. It has fluoride in it. Jennifer doesn't recommend it for children that are too young to spit. And then for that population of yours that's growing, that growing population that just does not want fluoride, if you want to give them optimal levels of remineralizing, both our strawberry and our mint toothpaste contains the 10% nano hydroxyapatite. Yes, we follow the studies, and yes, they're real nano crystals. In addition to that, she does put xylitol in at high levels on all of her toothpaste. We put in 14%, and yes, she loves the peppermint oil. For the small children that just don't like peppermint oil, she uses the extract, marigold flower extract, which does have some antibacterial properties. It's also soothing on the gums. The fluoride-free versions, by the way, I think you guys asked the question on age. There's no age restrictions on either one. We have adults that like strawberry. Most importantly, it's clean ingredients. It has the full concentration of 10%. With the mint, same thing, full 10% nano hydroxyapatite. The superpaste, you get it 10%, and over-the-counter levels of fluoride, which is 0.22, doesn't require a prescription, which is another nice benefit of the superpaste. What else do you got there? Anything else? Yeah, this is what's interesting. We have a lot of offices, and we've done this in Jennifer's office as well. If you have patients that have high caries or like decalcification, you can actually do a nano hydroxyapatite treatments. You can put the toothpaste in a tray for 3 minutes, have them spit, wait 30 minutes. It's just a great way to get added phosphate and calcium back into the enamel. Otherwise, we do recommend what most dental schools are recommending now, even with fluoride. When you're done brushing, just spit, do not rinse. That's going to allow maximum mineral uptake. They can wait 30 minutes. The Nano Hydroxyapatite is more expensive, and you probably already know this. If you want high concentrations of Nano Hydroxyapatite in the toothpaste, it's going to run the price up. However, for your patients that want clean ingredients and they want optimal remineralizing, optimal caries protection, if the toothpaste is usually going to run around $20. I think we talked about this on the previous slide. Typical toothpaste the tube should last about 3 months. It comes out to $6.67 a month. For the price of a Starbucks latte, you get a month's supply of toothpaste. And I think for your patients, once again, that are looking for a clean ingredient and they want caries protection, it's just a great investment. You want to go over these next 2 slides?
Oh, these are just, dental professionals, dentists that love the paste and recommend it to their patients. I think we have a couple people here that have done that. And then you can run through this bit.
Yeah. Okay. So if you guys are interested in getting this into your office, there's several ways to do this. Number one, you can buy wholesale. We do sell it wholesale. You get 40% off. The super paste price, your wholesale cost is $15 a tube. It retails for $25. If you compare this to, say, MI paste or high prescription fluoride toothpaste, it's actually less per fluid ounce, and it's going to last a lot longer. The other products we did mention, 40% off. So your cost is for the mint is $12, retails for $20. We sell it by the case. Those are the case prices on there. Let's see, we'll go to the next slide here. So we do have a promotion for this PowerPoint. So if you sat through this, if you stuck with us through all of this joyful science, you're rewarded. You get $50 off your first wholesale order if you decide to buy this wholesale. At checkout, if you go to our website, drjenoralcare.com, when you go to checkout, enter code CE50. That'll get you $50 off. As you can see on the bottom right-hand side, we're in the red chart. We are putting in the full 10% Nano Hydroxyapatite. Let's see, what's the next slide? Okay. Oh, yeah. For those of you that want to get this in your office, you're curious, you haven't used Nano Hydroxyapatite toothpaste, you're not familiar with Jennifer's toothpaste. If you go to our website, drjenoralcare.com, you can register your practice name. If you put your practice name and address, we will send your office samples that you can try. And then, yes, and for offices that don't want to deal with inventorying toothpaste, we do have a referral program as well. The way this works is if you take your smartphone and you scan the QR code, what that does is it allows you to set up a separate QR code for your office. So you can receive $5 for anybody that you do recommend to Dr. Jen's toothpaste. If they make a purchase, you can use it for Dr. Jen toothpaste credit, or you could just use it to help pay the electricity. If they use the QR code, your patients will get $10 off their first purchase. And then there's the free samples again. Okay, cool.
Hey, Peter and Dr. Jen, I want to remind everyone that the green banner at the top of the screen will take them to your website where they can claim their free sample. They can also shop and enter CE50 for $50 off any wholesale pricing. We have some questions here. Let's go ahead and address those.
Cool.
And a lot of hellos and a lot of thank yous and a lot of high fives on the presentation.
Nice, thank you.
Okay. Does your super paste have xylitol?
Heck yeah, love it. Great question. And that's really a hero ingredient, as we talked about in the clinical studies. The clinical study we referenced, reducing Streptococcus mutant, was at 10% levels. The super paste contains 14%, which is higher levels. So your patients get triple the cavity protection. You have fluoride, you got 10% Nano Hydroxyapatite, and you have xylitol.
Question, do any of these incorporate arginine?
No. Arginine is an interesting ingredient. It's mainly used to manage hypersensitivity. It's kind of like potassium nitrate or potassium chloride. You don't need it. There's really no benefit as far as managing hypersensitivity. I know there's some clinical studies now testing the efficacy behind remineralizing it. I think anybody looking at arginine, I would Google PubMed on efficacy behind arginine, but we're not big proponents of it. Our toothpaste doesn't need it. We don't see it as an additional benefit.
Okay. Quite a few hygienists out here that are working multiple offices or subbing. They want to know how they can get samples or purchase. And of course, they can also, quote me if I'm wrong here, scan the QR code to get information also and share it with these practices that they're subbing in. But go ahead, Peter and Dr. Jen. I don't want to take the stage here.
Yeah,
but
no, I would say if, yeah, we do have a lot of independent hygienists out there that are recommending the product. And if that's the case, yeah, just put that on your request. Just say, look, I'm an independent hygienist. I move around a little bit, and we'll be happy to send you some samples. And if it's something that they really like and they see is very helpful for their patients, yeah, we have, like I said, we have a scan code that they can download on their Apple Wallet or Android wallet that they can allow patients to scan to allow patients to get $10 off. And at the same time, they'll be rewarded $5. So yeah, just have them register as an independent hygienist on the drjenoralcare.com site.
And again, I reposted how to get the handout because it's in your course folder. You have a copy of this as well as the CE credits. So make sure you have that, take it back. For those of you that need to take the information to your practices, tap on the banner, bookmark that URL to your device, and take it back to your practices tomorrow, or you may want a little more time to look at things. Okay, we have so many great questions here. Any age for the fluoride-free? It says 6 and up.
Yeah, that was I don't even know why we put it on there. Now the fluoride-free mint, that was a discussion point. We have parents that introduce spicy foods to kids younger than 6, and it was just a judgment call. We should take that out. Really, if you have a child younger than 6 that wants to use mint toothpaste, go for it. It's not gonna be harmful. The strawberry, though, when Jennifer made the strawberry, she didn't put any foaming in it. It also is, it has a lower abrasivity. It's like a 38. It's just made for gentler mouth. So yeah, you can take the strawberry. That was really designed for infants and young children. That being said, we have a lot of adults that, they have, they don't want mint. They don't want mint, or maybe they have a reaction to peppermint oil and they use the strawberry. So there's no age limit on the strawberry. But yeah, if you have a child that likes mint younger than 6, that's okay.
Okay, we have a question here about what is the pH of Dr. Jen products?
Great question. You got a very intelligent group of folks. pH level.
We do.
Yeah. The Cool Mint, we have our pH tested on every run, every batch we do. The last batch was 7.1 on the Cool Mint. The Super Paste came in a little higher. It was 7.4. And the strawberry, I believe, was about the same, about 7.1. So we're pretty much pH neutral.
Okay, question here about your strawberry paste. Why does it have more of a texture of baking soda? I didn't see bicarbonate as an ingredient.
Good question. Let's see. Well, think about baking soda. If you're putting baking soda in a toothpaste, it's to raise the pH. Okay, so it's bicarbonate. That's what our saliva has. Our saliva has bicarbonate. We want a pH balancing toothpaste when we use it. So if they're asking a question, if I'm understanding the question right, why didn't we put more bicarbonate in there?
I think why does it have the consistency of bicarbonate? Is that the question?
I think so. Yeah. They're saying it has some consistency. It's a little...
The only difference,
the texture similar.
Yeah, the texture. The only difference is that there's slightly less foaming.
There isn't any in the strawberry.
And so I think that might be the only change between the
difference.
Yeah, it's a different experience, and the reason we didn't put foaming in the children's toothpaste because, as you guys know, the soft tissue, the gums, the children are just more sensitive, and so we wanted to create a toothpaste that was much gentler. We wanted this to be a very positive experience for young children when they brush, and so we took out obviously the mint because most small infants or children do not like mint, and then we took out the foaming.
Question here, when did you start making toothpaste?
Boy, we've been working on it for about 5 years. I think we finally launched it 2 years ago. We're coming up on almost 2 years ago. And we really brought it broadly. I did a lot of just my own patients and friends and family. And We did it more broadly, I would say. It's been about a year that we
Yeah.
brought it to dental offices anyway.
Yeah, we had, this is what's interesting. We had no plans on being where we're at today. And quite honestly, we wish somebody else would have developed this toothpaste, because we've invested quite a bit of our savings and time. But this is a passion project. It took us about 3 years to bring it to market. We started selling a year ago, last January, mainly in Jennifer's clinic online. And it wasn't until January of this year that we considered selling wholesale. We had no plans. What happened was January of this year, we were getting contacted by hygienists and dentists all over the country that purchased her product online, and they wanted to buy it wholesale for their patients. And so it was kind of an organic movement. It's just, we're here because dentists wanted us to be in this space.
Question, what's the difference between the super paste versus your regular?
Yeah, good question. They're basically identical. The formulations are identical with the exception of the super paste has fluoride in it. It's 0.22% fluoride. And this is where we talked about you get the synergistic effect. But as far as the base formulation goes, they're identical. 10% nano hydroxyapatite, same flavor combination, peppermint oil, black cherry, papaya. You didn't even talk about that. But the super paste just has on top of everything we could put into a clean ingredient, a toothpaste, it has 0.22% fluoride. It's got, this has double the cavity protection. Nano hydroxyapatite xylitol, this has triple. There you go.
Question here from hygienist. Can't put a check for lunch and learn. Can I still get the samples at the office without the lunch and learn? I can't get into work without checking that.
Oh my gosh, that's our website developer. So yeah, just check the box. We won't schedule a lunch and learn unless you guys approve it. So we apologize. Our web team was supposed to fix that. That's a website issue. So good to know. Thank you for bringing that up. So if anybody is trying to get samples and they can't get through to get the samples without checking the lunch and learn box, just check the box. We won't book a lunch and learn unless you guys really want one. We'll follow up with that. Sorry about that.
Question here, where can I buy your products to try them? Hygienist here travels to multiple offices and I don't have a permanent office, but would love to try them. And again, make sure that you tap on that banner at the top of the screen. It's going to take you to a contact and the free samples. And question about, I heard you say no foaming. So is there SLS in these toothpastes?
Good question. So that's a double question. And we didn't put this in there. If somebody just wants to buy it for personal use, you can buy it on our website, Dr. Jen Natural. You can use code OFF. Maybe, I don't know if you can type that in, Jennifer. OFF 10 will give you $10 off. Otherwise, we sell on Amazon as well. As far as foaming goes, so there's different foaming ingredients that you can put in toothpaste. Sodium lauryl sulfate is the most popular. Why? It's cheap. It's detergent. Okay. To replace sodium lauryl sulfate, there's ingredients that you can use that are derivatives of coconut oil. We just so happen to use a derivative of coconut oil for our foaming ingredient. It's very gentle. It doesn't cause the oral tissue inflammation. We use low levels of it only in our mint toothpaste. The strawberry version, because we really designed this for young mouths, we have no foaming on the strawberry.
Question from Deborah B., who's one of our most loyal followers here on our website as well as our social media. So I have to give a shout out to her. Dental hygienist wants to know super paste best for head and neck radiation cancer patients. What's your recommendation?
Yeah, that's a really good question. I think the answer to that is going to depend on what the patient's situation is. How bad is their situation regarding caries? If they're going through chemo now and their oral health is pretty stable or pretty solid, the fluoride free should be adequate. This is going to provide, as we referenced in the clinical studies, 10% concentrations of nano hydroxyapatite are going to provide the same remineralizing levels. However, if the patient is at the point where they have high caries already, and we want to do everything we can to give the enamel maximum remineralizing, the super paste is going to be a better product. So I think you're going to have to assess each patient individually in determining where they're at regarding caries.
Do you have any materials that our clinicians can print off to share with their patients?
We actually have brochures that we'd be happy to send. We actually have pamphlets as well. So when if they reach out to us at info@drjennatural, or even call the phone number later, we can actually send you some brochures that we have for our toothpaste.
Okay, question about can you explain the role of MI paste?
Love it. I love that question. MI paste was ahead of its time. We have to give MI paste credit for that. Here's a company that came up with an alternative to fluoride. Now, if we look at MI paste, though, number one, is it a clean ingredient? No. So for patients that are looking for clean ingredient, MI paste, if you look at their base formulation, they're not using clean ingredients, number one. Number two, the price. For a tube of MI paste, it's usually 1.1 ounces. It's like $20. It's super expensive. But let's talk about the remineralizing ingredients in MI paste. They use liquid phosphate and calcium. Okay, so for liquid and phosphate calcium to remineralize enamel, within the saliva, the liquid phosphate and calcium has to crystallize to nano hydroxyapatite. That's basically the biochemistry or biophysics behind using liquid phosphate and calcium. So that being said, MI paste it has some benefits to it as far as remineralizing. Nano hydroxyapatite crystals are different. It's more advanced in the sense that it's already in a crystallized state of phosphate and calcium. So it's more efficient for the human body to remineralize enamel using crystallized phosphate and calcium versus a liquid state. That being said, look at every situation, because we don't always, each person is different, and how we metabolize ingredients is going to be different. That being said, we have a number of offices, including Jennifer's offices, that have switched from a liquid calcium and phosphate toothpaste to Dr. Jen's nano hydroxyapatite, and they've had better results, less sensitivity, less calcification. But they're really two different products. Price-wise, we wish we could sell our toothpaste for what MI paste does, but I think it's a worthy replacement for fluoride, but it's not clean ingredient. It's very expensive, and from what we know about the science, nano hydroxyapatite crystals, the human body can more effectively remineralize the enamel with a crystallized phosphate and calcium.
Okay. More questions coming in here. Let's see here. In your toothpaste formulation, how do you decide the 0.22% fluoride with the nano hydroxyapatite?
That was based on a lot of the clinical studies and our chemist. We've actually worked with 3 different chemists. The first chemist we worked with was out of Europe. I don't want to disclose more of this for proprietary reasons,
Sure.
but it's a very delicate balance to be able to balance nano hydroxyapatite and fluoride. And so that might be a question by somebody who's trying to replicate the formula. If it is, good for them for asking that question. It's all I can say is based on the clinical studies done combining nano hydroxyapatite and fluoride, and based on the chemists that we worked with. And we had to play with this. We played with our formulation for 2 years. And there's other ingredients as well. How much silica do you put in? How much xylitol? The balances that you put into your formulation can affect the outcome of other ingredients. And so there's not a simple answer other than that. Our formulation took 2 years, and we're very proud of the results it's creating. And it was an input of really 3 other chemists, and plus using the clinical studies to develop our toothpaste.
Question here, will you be coming out with something like a varnish or mouthwash?
Well,
Good question.
do we have any angel investors in this group? Yes, we've actually developed, believe it or not, we've developed some of those products already. However, because we're using our personal savings, it's really hard to introduce more products. We get this question every day with a lot of our offices that are using our Jennifer's toothpaste. They're asking for these products. And so some of those products that you'd mentioned, we already have developed. Some of them, we have prototypes that you don't walk into our bathroom. Seriously, how many tubes do we have in our bathroom?
It's like a warehouse here.
Yeah, I mean, we have stuff. We have a lab we work with, and it's ongoing. And when our kids come home, they'll be home over the Christmas break. 2 of them are in dental school. We actually have toothpaste testings at our kitchen table. It's insanity over here.
That's a true dental family, I might say. Have you thought of Shark Tank? This is another question.
Yeah,
Mm.
we have ventured.
We have
go
gotten
ahead.
we have gotten quite far along there.
That was last year. This is how smart the Shark Tank guys are. We got pretty far along where we had to submit a video, and basically their analysts said that this is what they said. They said the toothpaste industry is too competitive. That's what they said. They said there's no profit margin in it. So we didn't go on the show, but and that's where we said earlier, we wish somebody else, there's days where it's like, why didn't somebody else create this? So we could have just bought the toothpaste, because it's not an easy path to go against. And as you know, this, Dr. Rowling, we have the giants out there that are just circling. And we were at a dental show in New York was it 2 weeks ago? And 5 different times, we had one of the biggest toothpaste brands sending their folks over there trying to figure out what is in our secret sauce. And it's just like, we really are the David, and we're going against the Goliaths. And we hope that in the future we can bring more products to market.
Well, I'm going to one more time remind everyone, and we've put in the chat area the instructions. Please be sure that you have this handout as well as the CE handout, because you can refer back to it. Also, one more time, tap on the banner at the top of the screen. We also have the link for you, and bookmark the URL, and that's how you'll get your free sample and your promotional discount. I think it's such a great story that started off with an unfortunate circumstance, and oftentimes that's how innovation it gets started, right? And as you both know, I survived a very serious C. difficile run myself, and I had a very difficult time finding things that I thought were going to be healthy for me, and I couldn't digest things very well, and I still am having problems. So I'm always seeking these, but I'm not the only patient in that situation. We have patients with all sorts of, as we saw, head and neck radiation and so forth, that are looking for these types of products. So I commend you both for taking this step forward, and then even venturing out to Shark Tank. I'll have to tell you my Shark Tank story sometime.
Wow.
We did one called Hatch. We actually did a reality show with my husband's basketball training tool, and it was interesting. So I want to thank everyone for being here this evening. I want to thank Dr. Jen for sponsoring the class this evening and presenting the class. And I want to thank everyone for joining us all, and we'll go ahead and adjourn here. Any closing remarks you two would like to say before we push the off button?
We are just so grateful for your time. Thank you, everybody, and for your support. Everyone's been very, very supportive and kind. So thanks.
And again, if your questions didn't get answered, you can track Peter down here. You have the information. Give him a call, email them. He'll get right back to you. Trust me. And I thank you again both. Have a great evening, everyone. And we're going to redirect you now to the quiz.